Hi, I'm Dr. Richard Cullen, the Chair of Rotherham CCG. Welcome and thanks for watching this rather unusual AGM. What you'll see is two videos, one from Chris Edwards, who's our Accountable Officer, talking about the performance of the CCG, and one from Wendy Allett, our Chief Finance Officer, who will talk about the finances. These are from last year, which seems more than a year ago with everything that's happened in the last few months. There will not be an opportunity with the videos to ask questions, but we'll ask you to send in questions over the next week if any questions arise from the two presentations. Thanks and have a good watch.
Hello, I'm Chris Edwards. I'm the Accountable Officer for NHS Rotherham Clinical Commissioning Group. I'm here just to update on the performance of the organisation during 1920. It was another successful year for the CCG. We've been rated outstanding by NHS England during the year, and obviously we'll get an updated rating at the end of the year. I'd just like to put on record our thanks to all our key partners, particularly our GP members, our staff, our partner organisations across health and social care, and most importantly our patients and public who engage with us to help design services and give us feedback about how services are performing. I'd just like to also take this opportunity to highlight some areas of performance during 1920. Some areas have been particularly challenging for us during the year. Cancer waiting times have caused us concerns. This has been a problem across the whole of South Yorkshire and Bassetlaw, where we work as a team to try and get the best possible services. We haven't managed to meet the 62-day target. This is a target from GP referral to first treatment, and we've achieved 66% of patients within that time scale against a national target of 85%. It's been challenging nationally, but it's an absolute priority for us going forward. Another area we found challenging has been the improved access to psychological therapies. That's talking therapies from our mental health services. We'd have expected access to treatment for 20% of our patients, but we've only achieved 15%. Again, this will be an absolute priority as we move into next year. Also, I'd like to highlight some areas where we've performed well during 1920. So 90% of Rotherham patients have waited less than 18 weeks for routine surgery. What that means is from a GP referral to diagnostic to treatment, everything is completed within 18 weeks. We've also performed well in dementia diagnosis. We have a national target of 67% dementia diagnosis rate. We've achieved a rate of 83%, which puts us compares very well with other areas of the country. Another area of performance which I'd like to highlight is our diagnostic performance. So that's the performance where you're referred from your GP to receive a diagnostic test. The national standard is 6 weeks, and 99.9% of Rotherham patients were seen within that timescale. Also during the year, obviously at these difficult times, financial duties are difficult to achieve, but we also met all our financial duties. This is something our Chief Finance Officer will explain in some more detail. I do have to note that during the year we also had the impact of COVID-19. COVID-19 came in towards the end of this year, but it didn't impact on our performance until the end of March. The true impact will be seen in our next year's report.
Hello, my name is Wendy Allett. I am Chief Finance Officer at the CCG. In 1920, the CCG received allocations totalling £435.9 million. Alongside these allocations, some £12 million worth of quality, innovation, prevention and productivity schemes were also delivered to address what otherwise would have been a funding gap between the costs of providing services at the levels required and the monies available to pay for them. The pie chart shows where money was actually spent. When given its financial allocation, the CCG is also given a set of conditions which it must meet, called business rules. These include requirements to live within our given revenue and capital allocations, to retain a cumulative underspend of at least 1%, to hold a contingency of at least 0.5% at the start of the year, to operate within our running cost allocation, and to meet a number of other national policy commitments, including, for example, to meet the Mental Health Investment Standard, to make certain levels of contributions to the Better Care Fund, and to make a number of investments in primary care. In summary, I am pleased to report that the CCG met all its business rules for the 2019-20 financial year, returning an in-year surplus of £1 million, assisting with the wider NHS financial position, whilst also increasing our own cumulative surplus to allow for future drawdown potential. Thank you for listening.